What is serious medicine? Why do you call it that?
Serious medicine is what you need to have a good life and to stay alive. When you go to the doctor, what you want to talk to the doctor about is lumps and pains and what hurts and what killed Granny. That's the essential discussion with a doctor. Health insurance, the finance of your illness, is secondary. The primary thing is serious medicine. What do I need to stay alive? What do I need to have a better life? What do I need for my kids? And that's what's been so catastrophically neglected by the current healthcare debate over the last few decades.
What do you think should be different? How do you think the country should attack healthcare in a different way?
The number of new medical devices approved by the FDA is down 40%. The number of new drugs approved by the FDA is down 60+%. The number of new antibiotics is down 80%. The amount of venture capital in the field is down by 1/3 to 3/4. In other words, the pipeline of new drugs, medicines, and devices, the stuff that we need to deal with Alzheimer's, to deal with Lou Gehrig's disease, to deal with cancer, are not being created. There has been what I call a crash in serious medicine over the last 20 years that nobody in the Washington political community has been talking about because they've just been obsessed with health insurance, whether it was the Clinton care fight of the 90s or the Obamacare fight of the O's. The entire obsession has been, how do we get everybody health insurance? Well, look, health insurance is great. Health insurance is nice. Health insurance is essential, but it's not as essential to your own life and well-being and longevity as actual medicine. A health insurance system in a country or a place with no medicine is by definition worthless. You go to the doctor and just sort of pat you on the head and says, lots of luck. That doesn't really do you very much good. What does make a difference in people's lives in a real way is whether you have the system is creating cures. Back in the 1930s, 40s, and 50s, we worked on the polio vaccine. And sure enough, in 1955, we had the polio vaccine was created, and all of a sudden, the lives of hundreds of thousands of people were being blighted by paralysis and even death in some cases, got better. It was like a light switch being turned on that went from polio being an incurable epidemic to something that's manageable. Now we see that even in the last few days, there's been reports from the World Health Organization that polio is making a tragic, disastrous comeback in some parts of the third world, which is only a reminder that the sort of strategy of eradication, where you absolutely positively eliminate the disease, as we did, for example, with smallpox. There's only one or two little viruses of smallpox left in some vault, hopefully staying forever at the Center for Disease Control in Atlanta. But polio, which we thought was in that category, is now making a comeback. It's a catastrophe based on the lack of medicine and vaccines as opposed to health insurance.
Jim, can you tell me about the March of Dimes? I know you've talked quite a bit about it.
Back in 1938, President Roosevelt created the National Foundation for Infantile Paralysis. It was a foundation that was sort of, interestingly enough, kind of notionally run from the White House. The line back then on public service announcements on radio was, send your dime to President Roosevelt so we can work on this horrible disease. And the comedian Eddie Cantor heard that and said, I get a dime to President Roosevelt. I get it. March of Dimes. And of course that stuck. That was much catchier than National Foundation for Infantile Paralysis. So March of Dimes stuck, and people in fact gave their money to this March of Dimes Foundation, which then in the 40s hired the visionary young medical scientist Jonas Salk, who put together the vaccine and immobilized the country. In 1954, when, of course, President Roosevelt had passed away, and then President Truman's presidency had come and gone, and now it was President Eisenhower, Salk went to the President, Eisenhower, and said, we need to test this vaccine. So Eisenhower said, well, okay, fine. 1.4 million school children across the country in the fall of 1954 were enlisted as America's polio pioneers. It was a great civic engagement, a victory for large-scale problem solving. And then on April 12, 1955, which is the 10th anniversary, coincidentally, or not coincidentally, of FDR's death, the FDA announced that the polio vaccine was, quote, safe and effective, the magic words for approval. And Now we went from a situation where polio was knocking down and crippling the lives of tens of thousands of Americans every year to essentially zero. It was a brilliant solution to a problem. The government in about 1950 did a study in which they said, if pre-vaccine, if polio continues as is, it will cost the government $100 billion a year in iron lungs, wheelchairs, death, and so on. $100 billion a year. Now, $100 billion, 1950 dollars, is along the lines of $1 trillion today. So we're talking, imagine if we were spending all our deficits and budget issues and so on today, we had another $1 trillion line item for wheelchairs and iron lungs and stuff like that. Well, again, instead of spending that, we're spending zero. And now, of course, as I mentioned earlier, we face the danger of a renewed polio epidemic with a much weaker, frankly, public health infrastructure than we had 50 or 60 years ago. So let's only hope, and then more to the point, do something to make sure that we eliminate this polio in these places where it's cropping up again, and of course, make sure it doesn't ever come to our American shores again. But at the same time, let's observe, gee, that was a better answer. Instead of having those debates over financing people's sickness so they can be chronically ill all their lives, let's intervene scientifically using medical technology to eliminate the disease. It's what we did on AIDS. In our lifetimes, AIDS went from being something that was so incomprehensible, people didn't know what it was. They argued about even the nature of the disease. That was about 1980 or 81. By 1987, we had AZT, which is a partial treatment. By 1996, we had the HART cocktail. And now polio still kills people in Africa, but it's a manageable disease inside the United States. This is what I mean by the word serious medicine. And serious medicine is a dramatic intervention in the course of a disease. It's not routine medicine of just going to the doctor and being treated, as important as that is, and being told to be healthy and engage in preventive medicine and so on. Serious medicine is when you get something that will kill you or make you really sick. Is there something we can do about it? And the answer for polio is that there was. The answer for AIDS is that there is. And the answer for a whole host of new diseases or chronic diseases we suffer from now, including Alzheimer's, Lou Gehrig's disease, diabetes, and so on, there basically isn't. So let's continue that strategy of actively intervening scientifically and medically to actually cure disease as opposed to simply pay for it.